On today's World Insight, a G20-led summit to shore up global cooperation against public health crises. Just how viable is a consensus on lasting international solidarity on pandemics? And 70 years of Tibet, the history and milestones, spelled out in a white paper made public on Friday. A look at the facts and the bigger picture.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN from Beijing. I'm Tian Wei. We begin with the ongoing G20 Health Summit in Rome. The summit is set to endorse a Rome Declaration for Principles, which is pitched as a guide for global cooperation in dealing with future health crises. Chinese President Xi Jinping delivered a speech at the summit via video link from Beijing. She said that China will provide an additional $3 billion over the next 3 years in other developing countries to support COVID-19 responses and economic and social recovery. He also calls for improving global disease prevention and control system.
China will provide an additional $3 billion in international aid over the next 3 years to support COVID-19 response and economic and social recovery in other developing countries. Having already supplied 300 million doses of vaccines to the world, China will provide still more vaccines to the best of its ability. China supports its vaccine companies in transferring technologies to other developing countries and carrying out joint production with them. Having announced support for waiving intellectual property rights on COVID-19 vaccines, China also supports the WTO and other international institutions in making an early decision on this matter.
Well, with the Global Health Summit, what are the prospects of a consensus on dealing with the pandemics, particularly the vaccines, and also the future road ahead? Let's ask our panelists. In Providence in the U.S., Dr. Megan Ranney, emergency physician from Brown University. In Seattle, also the U.S., she's originally coming from South Korea. Dr. Alice Kim Kyung-tan, internist at the Ms. Medi Women's Hospital. And last but not least, in Nanjing, Wu Zhiwei, director of the Center for Public Health Research with the Medical School of Nanjing University. Ladies and gentlemen, welcome to the program. Now, with the Global Health Summit and all the speeches delivered by the global leaders, are you more optimistic about the prospect than before the summit, or remain the same? Let's have the temperature check first. Dr. Ranney.
So I'm a little more optimistic because when global leaders state their commitment to collaboration, both in distribution of vaccines and in supporting populations around the globe in recovering from the pandemic, once they've made those public statements, they kind of have to follow them up. But the proof is going to be in the pudding as to whether they do follow through and to what extent they provide both funding and technical support.
Pudding, funding, support. So let's go to Dr. Kim Kyung-tan from South Korea. What about your temperature?
I am more optimistic currently. I think today's event was really an opening act for the upcoming World Health Assembly, which will be held from May 24th to June 1st. And I think that's when the concrete steps for how to get over this current pandemic, prevent future global health crises, and make our world a healthier, more equitable, sustainable place. I think that's when the nitty-gritty work will be done. So I'm glad that today's health summit occurred. I think that there is much more work to be done, however.
Dr. Wu, what about for you?
Yes, I'm actually pretty optimistic and pretty encouraged as well, because if you look at the current situation of the pandemic, we are at a critical point that we need to have an international community to unify and also act in coordinated manners, because once we have vaccines, we need to utilize those vaccines in the needy countries and the areas basically trying to pull down the virus. Otherwise, when a few countries have the virus under control, then you won't be able to solve the problem of rebounds. That's what we have seen in the past is exactly the same pattern. So the political leaders come together, build up the trust, and then evenly distribute the vaccine. I think it's very critical.
Well, they at least are talking about it right now. Whether that will be translated into actions, we'll have to wait and see. But talking about actions, there has to be ways in order to really act. We see it on multilateral platforms, such as with WHO. Well, WTO also talk about the patent issues related to the vaccines. We also seen it in a bilateral way. For example, China and some of the other countries, the European Union, some of the other countries, even between Africa and the European Union. But the thing is, which works? And how it works now. Dr. Rani, I want to ask you about the WHO ACT, which is an accelerator focusing on vaccine, research and distribution, tests, and medicine as well. We are still more than $15 billion short of funding. We are not seeing much commitment this time from leaders. So really, multilaterally, what is the state of the reality?
So I think that we're facing a bunch of different issues. We have COVAX, we have ACT, we have each individual country's investments to create effective vaccines. Those are all competing right now. What I would like to see is I would like to see the world unify on a single platform to help get the vaccines that have already been developed out into arms.
What
in
is
the
that
short
single
term.
platform that
Well,
you are
also,
referring to?
So COVAX is a great platform right now. If each country committed to donating money and or doses of vaccine to COVAX to deliver to the countries across the globe, that would be transformative. And they've already demonstrated through Gavi that they have an ability to work together multilaterally, that they have the buy-in of low and middle income countries. Why go and recreate the wheel? And yes, we need to invest in creating more new vaccines, but we have vaccines that work. Let's use these and invest in increasing their production in the short term, because now is the moment where we need to fight this pandemic.
Did I understand you
we're
right?
still going to need stuff a year from now, but we need to do things today.
Did I understand that right? Their understatement there seems to be, why the ACT accelerator of WHO compared to COVAX? Is that what you're trying to say?
That's correct. I see the ACT accelerator as being an important long-term strategy, but COVAX for now has the capability to help stop the pandemic in the short term if we invest in it adequately.
Okay, interesting. Now, there are a lot of debates. This is one of those. But if you look at COVAX, Dr. Kim Kyung-tan, we understand much of the COVAX vaccines to be distributed should be produced in India. But now, with the situation in that country, unfortunately, we are not seeing the delivery of that. And therefore, the COVAX platform, despite the credibility it has had, China including giving credibility to it as well, we haven't seen it delivered its promises. So there seems to be a whole chain of issues related to COVAX right now. Dr. Kim Kyung-tan.
Exactly. So because of what's going on in India, unfortunately, there are many countries that are wanting and waiting for vaccines. I think what you're addressing now is the issue of scaling up manufacturing. Right now, we think that it's going to take 6 to 9 months for us to have manufacturing up to the scale that we need to fully vaccinate, or even try to fully vaccinate 20% of the world's population. One of the ways that we can get around this is through contract manufacturing of vaccines. I think there is a lot of manufacturing capacity that has not been tapped into in middle income countries. South Korea certainly has a lot of biotech and pharma resources that could be used to make more vaccines. Of course, our SK Bioscience manufacturing plant is kind of taking up the slack of making more AstraZeneca vaccines, but there are other biochemical companies, pharma companies that can really be put in the game to help end the pandemic. But what we need is technology transfer, we need know-how transfer, we need raw materials and the supply chain to be sustained and guaranteed and protected. And these are all things that both the WHO and the WTO need to work together, including all of the world head leaders. They need to get together and make this happen because, as Dr. Rani said, we know which vaccines work. That's not a mystery anymore. We know which vaccines work. It's just a matter of manufacturing to scale and delivering them to the people who need them.
Dr. Tan, though, I want to remind you about the debate that is already taking place quite some time, that the United States government, this administration volunteered to have this patent waiver of the vaccines. However, the manufacturers who are really having the patent of these vaccines do not want to have a waiver of the patent, which means the politicians' promise actually ended up empty. So this is a very interesting issue. Meanwhile, you also see different opinions from the European Union, from China, from some of the other countries. So this is a very interesting story as we speak. Dr. Wu from China, what do you make of that? The early two speakers already talk about the platform issue, even on the same platform, how the things could be done, whether it's scaled up or not, how to scale it up. And on the issue of patent, this to be a thorny issue already. So to you, what is the key?
Well, simply waiving the patent rights is not the solution because nowadays vaccine manufacturing, production, distribution are rather complex the issue. It's no longer a single company producing the entire vaccine. Basically, they have to procure all sorts of ingredients from different countries. If you simply waive the country without a proper arrangement, one of the potential problem is that everybody would try to purchase those ingredients and manufacture the so-called vaccines. Some may be underqualified, it may not be qualified for immunizing general populations. So there is a lot of issues here. You have quality controls and safety issues. So I think the proper way of doing that is that different countries, particularly industrialized countries, have to sit down and basically lay out in the plan and do an arrangement how to better distribute the vaccine. The production is an issue, but it's not the key as we have seen it. The key is that the wealthy countries procure most of the vaccines produced, and some of them are not used. That's the real problem. Actually, in a situation like India's pandemic crisis, I think there are a lot of ways, the industrialized countries could, lend a hand and help. I think the distribution is the key. That's why we need a COVAX. This is the platform WHO created to have an equitable distribution of vaccines. But so far, the COVAX has not achieved its goal in procuring sufficient vaccines.
It's very interesting, a situation that we're facing right now. There are only 3 panelists for this discussion, and you have very different opinions about what exactly is the key. Dr. Rani said it is the platform, that is the key. Dr. Tan said it is the patent, that is the key. And Dr. Wu said, well, it is the distribution, that is the key. See how complicated things are. But having said that, though, let me ask you about one crucial issue. I hate to say everything is political. Unfortunately now, it is very political, our world today. And therefore, export control becomes something that is not that far away from the reality that we're talking about. So to what extent do you think these politicians and political leaders, if they really want to commit to what they're talking about, need to do about the global system of supply chains and also cooperation based on supply chains earlier, and be able to deliver that? Dr. Rani.
So I am certainly not an international trade diplomat
but you
or
are a
supply
doctor.
chain expert.
Something close
but
to
I
your
am
turf.
a doctor and a
Yes.
public health professional.
Yeah.
Yes.
What is going to be
and
the
I can
call
say
from
that, you know, both with the vaccines, right. So both with vaccines, just as we saw with personal protective equipment last spring, we've seen the way in which these international supply chains really determine the public health of the world. And we've seen the need for multilateral collaboration in order to facilitate that supply chain. And so I actually do agree with Dr. Wu that to a certain extent it is about production and about that chain from raw materials through getting them in factories, through getting them in arms. And to a certain extent, I think all three of us agree that that's what's needed. You know, Pfizer is already producing 4 or 5 million doses a day. If those can be exported to low and middle income countries, and then we can provide the investment to get those in arms, that's what's needed. And I would love to see us come out of this pandemic and create a new version of supply chains in which we recognize that each of our stepping up to support each other's health helps us as well as others. You know, there's talks about vaccine diplomacy, which I think is really important. Just as we had the Marshall Plan after World War II to help support the development of European countries that the United States invested in, similarly, we're seeing the US, China, and others now step up to support the public health of low and middle income countries. That helps them as well as us.
We hope that is the real support. I understand about the China story, Dr. Rani, that there are doses of vaccines being provided to the developing countries, particularly the least developed economies, such as those in Africa and Latin America. Dr. Wu, I do not want to finger point anyone, but it's very interesting that there are much more, several times of vaccines available, let's just say in the United States, than what the whole population could be able to have to use in the coming months, but yet are unwilling to export or provide to the developing country. We've heard a lot about talking about it by the politician. We haven't seen the actions yet. Dr. Wu, but the question is, will China's way of doing it and China's promise earlier delivered by Chinese President Xi Jinping be sustainable?
Yes, when I look at the data, actually, I think it's pretty sustainable, and basically China is trying to fulfill its promise. So far, about 40% of what, the vaccine producing in China has been exported to other countries, and by either bilateral agreement or through the UN's WHO's COVAX program. So this is actually quite encouraging numbers. Of course, China, the pandemic new infection rates are at a very low, historically, it's extremely low. I mean, although we do have some kind of a sporadic bounce back, but this is something actually China has been doing. So I think as the pandemic situation in the United States and other countries are actually improving, diseases, new infections are under control. So I hope that they will be able to fulfill their international obligation and play a big country's role.
Well, one of the things is about vaccine. The other thing is about prevention and control, isn't it? Of course, vaccine plays a big role, but let's take a look at the latest situation when it comes to how this pandemic is spreading around now. The pandemic is still hitting the world hard. Here's a look at today's global COVID tally.
The latest Johns Hopkins University tally shows the world has more than 165 million confirmed COVID cases and more than 3 million pandemic deaths. The top 3 hardest hit countries are the U.S., with more than 33 million confirmed cases and 588,000 deaths. India, with more than 26 million confirmed cases and 291,000 deaths. And Brazil, with 15 million confirmed cases and 444,000 deaths. The tally also shows vaccine doses administered worldwide total more than 1.5 billion.
Sad number. we thought we could be able to control it within the year 2020. And then we thought about, well, maybe early 2021. And now we're already in the middle of it. And we're thinking, what about the end of 2021? And that is not necessarily going to be a promise. So Dr. Kim Kyung-tan, you and I were talking about that from the early beginning of 2020 last year. Looking at the situation, what are we lacking in terms of prevention and control? Let's just put aside the vaccine thing, focusing on governance. Very briefly from you.
Well, you talked about the role of politicians. And I think a very important role of politicians right now is to be very honest about the short-term, mid-term, and long-term picture in terms of what will happen if we do not share doses, if we do not donate more funds into COVAX and make the WHO a more effective institution. The Independent Panel for Pandemic Preparedness and Response, they outlined steps that we could take to end this current pandemic and to prevent future pandemics from happening. They said, let's make this pandemic the last. And I think that reading through their recommendations, one by one, and really making them happen is the way to go. And in terms of governance, it's really about educating the public in terms of how we need to be committed to a global solution to this global problem. Because the negative effects, if we only think about our domestic issues, the negative effects will come back twofold, threefold, fourfold, and this pandemic will just extend even longer. And so I think making people understand that that is the reality, that we can't just say, I've been fully vaccinated and so now I'm okay, or the United States, we have enough doses so we are safe, that is simply not the reality of this pandemic. And I think we do need to open a lot of eyes and let people know. And once the public understands this, then the politicians will feel empowered to make those donations and to think outside of their borders and to think more globally and support the global cause. It just becomes very, I think, difficult for politicians to invest so much money outside of their, domestic pockets when people at home don't understand the need for that.
Crucial times, we all understand human nature, but it is also should be with human logic that we understand if others are not safe, we are not safe either. Dr. Rani, very briefly from you, governance issue, how it needs to be improved from a professional doctor's perspective, once again, briefly.
Yeah, so briefly, outside of vaccines, getting vaccines in arms, investing in those, both the procurement and distribution of vaccines, I also don't want us to forget about those non-pharmaceutical measures. So for people who have not been vaccinated yet, which is the majority of the world, the importance of masking, the importance of good ventilation cannot be overstated. And we can't forget about that because off of the previous commentator's point, just because we have parts of the world that are largely vaccinated, that doesn't remove the obligation for the rest of the world to keep trying to keep protective measures in place. And that's part of what happened in India, right? They removed those non-pharmaceutical interventions before they had an adequate percentage of their population vaccinated, and we've seen what happened. I don't want other countries to make that same mistake. And even here in the United States, it's important for us to remember that non-vaccinated people do need to continue to mask up in public.
Right. Dr. Wu, China is speeding up the domestic vaccination process. We still see a huge proportion of the population not yet. How do you see this process? Very briefly first, and then I go to the governance issue with you.
Well, actually, I think we're doing pretty good. Nowadays, it's about 10 million doses a day. So we're basically looking at in either October or November that about 1.2 billion population will be vaccinated. So that's about 80% of the population. And we hopefully by the time we will reach, achieve herd immunity. So that's pretty much our calculation. I think we are moving optimistically towards their goal.
But what about the governance issue? We have seen Chinese President Xi Jinping be able to share some of the best practices China had over the past 2 years with the colleagues at the Global Health Summit. We also see some of the commitment that he made on behalf of China this time as well. We are likely to see more discussion of that during the UN Health meeting, of course. So, Dr. Wu, how do you see, China's governance issue on this global pandemic? Do you see China could play more, shall we say, responsible role, which has already, if you look at the vaccines and things, what will be that role that you look at as a professional doctor?
I think that China is playing quite an important role in fighting the pandemic globally, because China is one of the largest vaccine producers in the world. We right now we have about 3 billion doses per year production capacity. Although we haven't reached that full capacity right now, but currently I think we are something about 2 billion doses per year. So we're basically trying to ramp up the production to the full capacity. So once we have that capacity, that China would be able to distribute more vaccines to other needy countries. So that's what President Xi Jinping is talking about. Once we actually increase in the vaccination population, then we will be able to provide more vaccine to other parts of the world. So that's a very important contribution to the world community. I think this is something we have always been doing. I think this is what we call it, in the culture, that you have to work in a group to achieve a common good.
Yeah, we know what were the lessons coming from the last pandemic, right? 100 years ago almost. We know what needs to be done now collectively and individually as well. I think the only thing that we need now is that last mile, quote unquote, that is to really to do it and do it with responsibility. I hope that will be the wake-up call from this summit, and hopefully we're going to have more real actions follow up. Thank you so much for the three of you, 3 professional doctors. Really appreciate it. Wu Zhiwei, Alice King-Kang-Tan, Megan Rani. Thank you so much. Thank you. And you're watching World Insight with me. Let's move on now to the poverty elimination issue. In southwest China, extreme poverty weighed heavy on people living in areas around the Nujiang River in Yunnan province. But now villagers there are making better living thanks to tourists visiting their hometown. Recently, I got up close in the home of a family there to find out what's been done to change the dire conditions and how the locals are working their best in order to change their fate. Take a look. The Nujiang River runs through one of the most beautiful stretches of scenery in southwest China's Yunnan province. Lofty mountains, virgin forests, and river rapids. Despite its rich natural resources, the place has been suffering from extreme poverty throughout history. But at the end of last year, its 550,000 residents finally bid farewell to extreme poverty. How it has managed to do it, many here in China and around the world have been asking that question. Just like those at the International Forum on Poverty Governance and Development towards Modernization.
Very interesting to hear how China has done it in a very multidimensional way.
What is this multidimensional way?
Through access to social security, to education, to e-commerce platforms, as I mentioned, for farmers to have better knowledge and access to the markets, and it's very impressive.
China is also leveraging in establishing some of the infrastructure, agribusiness, economy kind of thing, and also a Belt and Road initiative, which we are also focusing to assist us to eradicate poverty.
It is important to also take care of the environment,
Indeed.
have the ecological protection in place, and especially
the
also,
culture too.
yes, respect the culture and the people from that specific locality.
I also asked that question to Mr. Guo Weimin, the organizer of the forum.
We must consolidate the progress we've made with poverty alleviation and transform the New River region into a more prosperous place, where all ethnicities unite together, where distinct cultures are protected and ecology is preserved.
Those theories are not abstract if one makes a trip to the home of Zhonghua and Siniu. They are farmers from a small village less than 1 hour drive from where the forum is being held. Like many other families, they were extremely poor. One could tell by taking a look at their old house. Now with the combination of farming, herding, cooking for tourists, and being tour guide for photographers who are fascinated by their hometown's flora and fauna, their lives have been improving. They also received in recent years a handsome sum of money from the local government to help poverty-stricken families. With that, they built a new home. The old and the new, though a few hundred meters apart from one another, embody a totally transformed family life. Ending extreme poverty is a historic achievement, but how to continuously improve people's lives, that is going to be a gigantic topic in front of all of us. Tianwei, Nujiang Prefecture, Yunnan Province. That report was made during my earlier trip to southwest China's Yunnan Province near the ancient Tea Road. You're watching World Insight, still to come. 70 years of Tibet, the history and milestones spelled out in the white paper made public on Friday. A look at the facts and the bigger picture, coming right up. This is World Insight. I'm Tian Wei. 2021 marks the 70th anniversary of the peaceful liberation of Tibet, and China issued a white paper on Friday to look back at the autonomous region's history, transformation, and achievements over the past 7 decades. The paper lays down the governance of Tibet in the new era, which will include the 4 top missions: ensuring stability, facilitating development, protecting the environment, and strengthening the frontiers. The white paper also aims to set the record straight on claims made by a number of Western countries by providing the international community with a balanced account, the bigger picture, so to speak, of Tibet today. On the latest situation and analysis from a Chinese expert, Rong Ying, Vice President of the CIIS, China Institute of International Studies. Mr. Rong, good to see you. I know you made several trips to Tibet over the past years, 2009 and 2010, if I remember right, that we were talking to one another. So tell me more about what you saw there. What did you see as interesting to an analyst like you?
Well, for Chinese, scholars like myself, who are mostly devoted my career for international politics and relations, a trip to Tibet is something very special. And of course, I think in my previous trip to Tibet, I learned a lot. And then also, I think, impressed so much by the achievements and the progress that has been made in the past 7 decades. But more importantly, I will feel shocked and surprised by the misunderstanding of this international community. When I talk with them, talk about China's development, I think most of them, I have to say, they are very impressed. But when we talk about the development progress in Tibet, they raise some questions, say some issues, which I think for me is very difficult, unless they see their own eyes. So I only my only sort of argument, if I can say that, the seeing is believing. I hope that, yeah.
Now it's difficult because of the pandemic. People could hardly travel, not to mention from outside into Tibet. But it's important that we set the record straight. So let's take a look at the numbers. Tibet has come a long way. Some of Tibet's achievements 70 years after its liberation. Take a look.
Statistics show that in the past decades, Tibet's GDP grew by 1,090 times to 190 billion RMB in 2020, with the average per capita income of a year-on-year increase of 10%. Another significant indicator is the average life expectancy, which doubled from 35.5 years to 71.1 years in 2019.
All right, those are some of the numbers, even though a bit abstract, but it certainly shows how Tibet has been developing. Its economy, GDP-wise, has been growing more than 1,000 times if you compare, 70 years ago and now. But let's just make it more concrete, the issues. For example, what about the sustainable development of Tibet, particularly, the cultural heritage and also the ecological protection? We know this is one of the most sacred and beautiful places in the world. So, Dr. Rong Ying, tell me more about that. How did you see that is being done right now?
Indeed, this is a very good question, and also I think a very good perspective for whoever who is interested in Tibet, the development, the culture, and the environment. That is a comparative study, and also they have to take into account the speciality, the special national conditions, natural conditions, in Tibet. So I think the trip I did in 2009, I think that I very much impressed. I said, loved the environment. But in the meantime, I would, from time to time, when I talk with the interlocutors, colleagues, others, they also, complained, if I can say, about the need for development, because the constraints of energy and others. So they are facing a similar sort of problem or dilemma,
right,
like any other places in China and others, how to strike a balance, the need for development, the better life, and also the need to ensure the protection environment. And of course, I think we're talking about Tibet and also the protection, the preservation of culture. So looking back, I think if you look at the past 70 years, 7 decades, so far, I would say that it's fair to say
so you're saying
the white paper has given a very good picture of how we achieve that kind of a balance.
So you're saying that what the challenges for Tibet right now, particularly on those two fronts, culture and ecological protection, is not unique to Tibet, but rather a question facing all over China, even though they are under different circumstances. I guess that's what you meant. Is that what you're trying to say?
Yeah, that's exactly the point.
All right.
I would like to make. But that point is even more salient or important for Tibet, because Tibet is so special. It's the need for development is so acute, and the need for protection and preservation is again so acute. So how to achieve that? To achieve that is a miracle. And I think so far, the past 70 years, and the white paper had made it very clear that miracle has been more or less created.
All right. I guess it's not fair to ask you on very specific issues on those two fronts because you're an analyst of international relations. But so let me just ask you one final question before we go. Facing what you consider as misunderstanding about the realities of Tibet from some of the others that you mentioned earlier, what do you think are the reasons for that? And if there were a way, what would that be? Dr. Rong.
Yeah, that's again a very good question. The reason for the misunderstanding or even misunderstanding of that or misinterpretation of what is happening in Tibet is a kind of predisposed sort of or assumption that Tibet is so special and Tibet is somewhere that does not need development, or Tibet, the conservation or preservation of Tibet, the environment, ecological system, and culture should be done or cannot be done without sacrifice of the development. That is something I think quite common point, problem facing the misunderstanding. But having said that, there are other extreme which I think beyond a normal debate like that, because simply they thought that what is happening in Tibet, the achievements, progress, and the challenges of balancing these challenge, this problem is something that they just lose sight and totally ignore that without no intention or no interest at all to learn about the history, the conditions, and the need for development of the residents.
In other words,
and this is
will geopolitics and politics shield our eyes from access to understanding better about what exactly is going on, whether it's in Tibet or elsewhere in the world? That is an important question you just raised. Dr. Rongying, thank you so much for your input. And that's all the time we have for today. If you'd like to see more Search World Insight, check out our YouTube channel, follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now and have a wonderful weekend.